complicated in treatment if you're looking at it? Dealing with, you're talking about, it's not one doctor.
Yeah.
Does it make it more expensive and complicated, or how do they now go about it?
Definitely, there's a financial burden to that. But when you fail to follow up, you're going to spend more. And what I assure patients, when you're keen with your primary doctor and you work together, you find that, for example, if I have diabetes and my sugars are controlled, my control metrics are matching up. Maybe you find out that you see your diabetologist maybe once in 4 months, one in 6 months. So your primary care doctor will advise you, no, your sugars are okay. We can push the visit maybe for the next 3 months. In terms of psychology, also remember GPs are trained to be able to give the basic level of either psychology, nutrition and all that. We can be able to handle this unless you want advanced. So even when you're working with your primary doctor, they can understand how your pockets are. Because if I'm sending you to a nutritionist, something that I can be able to do just to save you that amount that you can push to medication therapy, I'm sure with a good caregiver, they'll start with first training you on nutrition. They'll do the psychosocial support to the aspect where they can. And if you need further or advanced support, that's when they push you. So the primary caregiver is the one to know that how are my patient's pockets and the way option, how much does the patient need this service? Or can I wait for 6 months? Can I wait for that? So that's why I said, when it comes to the program, the primary health caregiver is the one to guide you. And that is like your friend, they know you. Anajua nikimtuma on a specialist 4,000, we might miss medication. So what is the priority here in the program? Is first the medication therapy, the rest I can manage. And remember, as a primary caregiver, I have access to all these doctors. I can take your history and I go talk to a diabetologist. I have so-and-so patient, this is what is happening, what can I do? So that the program brings that. In as much as you might not have the financial muscle to go see the specialist, but I can act as a bridge to that until maybe you are able to have that financial muscle to be able to meet all the clinical. And I know financially it's crazy, especially if you're paying cash. It's when I tell you every month you have to see a diabetologist, you have to go see a nephrologist for your kidney, you have to go see a nutritionist, you have to go see a counselor. We are talking not less than maybe 20,000 in terms of consultation fee alone in a month. So the program is made in a way that your primary caregiver is your friend, will ensure that they bring cohesion between all the departments. They can do their minimum until that you really, really need that next step of care. But if there is abundance of money, why not? Let's do it all. Yeah.
But do you see a lot of these patients coming to your clinics, Dr. I say, are these patients with a lot of chronic illnesses, not one, say we were talking about hypertension, we're talking about somebody comes in with, say, diabetes, but do you also have those who come in with all these, symptoms of chronic diseases, and now they're actually diagnosed with them? Do you have them in your facilities?
Yes, definitely. Actually, as I said, most of the patients, because of how the care is set up, they start with one. And when I'm talking to my patient, that is something I really drive. You come with hypertension, I start you with one drug. I would really, really want us to remain with one drug, if possible, because if we don't take care of you, you go to 2 drugs, you go to 3 drugs, now we go to complication, kidney and all that. And majority of the people, I can say more than 30% of the people in the program will have multiple comorbids. We call them multiple comorbids. So they have hypertension, they have kidney, or they have heart issues. Others are already at the complication level. So it's a common scenario, especially at the start of treatment. There was no proper follow-up of the patients. Yeah.
Chances of survival for people who present with various chronic illnesses. One body, various chronic illnesses. Does it reduce the lifespan and chances of, survival? Because you say sometimes there could be hope of, living a normal life and living longer. But if you're presenting with a number